Peace River Center provides outpatient therapy services in a variety of locations across Polk, Hardy, and Highlands counties. Services offered for children and adults ages 0 to 99 plus in the format of the individual and/or group therapy setting. Coming up, we'll talk about their Community Action Treatment Program, and make sure you stick around. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio today, we have Cindy Morey, who is an LCSW and an MCAP, and the team leader for the Peace River Center CAT team, which is the Community Action Team. So welcome, Cindy. Thank you for being here.
Thank you.
So you were talking before the show, and you have a lot of experience in the substance abuse, mental health, which I think now they call behavioral health, field. So 25 years of experience, and here you are with the CAT team.
Yes, here I am and loving it.
Fantastic. Well, let's start off. Tell me, for those of our viewers who may not know, tell me what the CAT team is and what you all do.
Okay, so CAT stands for Community Action Treatment Team. So we're an intensive team of people, so there are about 10 of us. So we work with children and their families who have mental health problems. They might also have substance abuse problems along with those mental health problems. And we work in the community, so we go into their homes, into schools. We work with them to stabilize the family, not just the child, because the family is a big part of developing those skills. And our goal is to help those families avoid out-of-home care. So sometimes mental health issues and behaviors get so out of control that those children end up in psychiatric hospitalizations, in residential placements, any kind of residential group placement associated with legal or Department of Children and Families Abuse and Neglect. Any number of issues could place them at risk. So the CAT team wants to avoid that and help them to function at their best in the community.
Now, you have on your team, you have a variety of different roles.
Yes.
You've got case managers and you got therapists too?
We do have therapists, so so all the families on our team receive psychiatric evaluation and ongoing medication management. Therapy, that includes individual therapy, family therapy, group therapy, case management, parenting skills for the family, mentoring for the children so that there's somebody that just comes alongside of the youth and starts to see things from their perspective and really works with the entire family to stabilize.
That is something that I think a lot of people outside looking in forget, that one particular member of the family, or in this case one child, can't be solely responsible for their environment, because the environment plays such a role in how we behave and respond, and it teaches us how to act with other people. So I think it's amazing that the approach encompasses the entire family unit.
Yeah, family and community support is so very important to children and adults with mental health problems and substance abuse problems. Those things make a big difference in themselves. So if we can work with the entire system, the systems approach as a social worker, if we can work with the entire system to help give everybody some skills, then that works best.
Absolutely, that's like the dream team. Everybody's got some tools that they can use.
Absolutely.
So this group of young people that you work with, these are people that have sort of not done well in traditional outpatient settings.
Absolutely. We call them lower levels of care. So someone mom and dad or family member, caregiver might notice that the child has some problems, so they take them to therapy. And so then they might work themselves up to where they're having therapy a couple times a month. Maybe they're seeing a medication provider, someone to give them some medications psychiatrically, and that's just not working for this family and this child. And so many of our children, of our families, have worked their way up through the systems, and they've been disappointed and this hasn't worked. And also they've gotten help from other agencies. So often a family will start with outpatient individual treatment, and they'll be doing that, and then either a different agency or somebody not connected with that program will start providing medication management. And then they might even have another agency involved in case management and parenting skills. The CAT team, we're all one cohesive team, so there's a lot of communication with each other, and all of our services are linked. So our medical provider, Patty Clark, is connected with the case manager, connected with the therapist, connected with the parenting person, the mentor. We're all connected and communicating about the case and about the needs of that family.
I think that's what you have to do. Finally, everybody's in the same room talking.
Exactly.
So before we get to that point, there's really a process that goes into seeing who this treatment is appropriate for.
Yes.
So tell me a little bit about how that works and some of the criteria to basically get your services for the CAT team.
Okay. So we take on a family identified by the child or the youth. So children typically 11 years old to 21 years old who have absolutely a mental health diagnosis. Again, they might also have, along with that mental health diagnosis, a substance abuse issue, and that's okay. But then they might also have a history of psychiatric hospitalizations, multiple contacts with law enforcement or through the Department of Juvenile Justice. They might have a Department of Children and Families case. Also, typically, school disruptions or severe problems in school.
So not only do they require mental behavioral health care, they also are really having, really seeming to act out. They're very high risk in the community.
Yes, those problems are showing up in their life. They're showing up at school, they're showing up at home, they're showing up because they're being hospitalized or Baker acted often. Those are the kids that we want to come around and help stabilize.
I got to tell you, I think that program is so neat. I had the pleasure a few years ago to actually come and see how it worked, and it is just the coolest thing to see how those kids grow over time. When it's amazing, when you give someone something that they need, and you teach a family how to be that thing that they need, it's just, there's nothing better. So
it's true. I'm relatively new. I've been there just a few months now. So one of the things I did was interview families as I met them for the first time. And so tell me about your experience with the CAT team. And it's just as you said, so many times if it had not been for the CAT team, I don't know where we would be. We were completely at a loss. Children were telling me I felt completely out of control. But now I have these skills, and it's beautiful to hear them talk about their coping skills. Like, I can cope now, and they talk about all the skills that they use, and it's a beautiful thing, and it can be taught. There is hope. Coping skills can be taught, and children and youth and family and people don't have to just live their lives reacting to things. They can develop skills to function better.
The kids, the last time I was over that way, they had some sort of I don't know if you still do this kind of thing, but they had this talent show, and so they were all like performing like songs and things like this, and I think one did like hand puppets, and it was just amazing to see that confidence level, and every single one of them, because they're in group together, really seemed to support the other.
Absolutely.
Like they kind of got that, hey, we're in a rough spot and it's kind of tough. And
yeah.
But going back to what you said about the criteria, in some other terms, I just kind of want to recap and see if I got it right. So to be eligible, they must have a diagnosed mental illness. And is it necessary that they were Baker acted?
No. So they must be 11 to 21 years old. We actually will accept younger children if they have more of the criteria. So if they're more severe and they're younger than 11, we also will consider them. So they do have to have a mental health diagnosis, but then they just have to have one of the other eligibility criteria, such as multiple Baker Acts or psychiatric hospitalizations, contacts with law enforcement, or school disruptions, maybe a DCF case.
Those little indicators that say, hey, we could really do some good here.
Correct.
Gotcha. And so if this program wasn't in place, the next stop for many of these kids and their family would be the state hospital?
Would be residential
or
care
residential.
In some form or fashion.
Okay.
Longer term psychiatric hospitalization called SIP placement, statewide inpatient programs, or residential facilities associated with DJJ, those programs, those boot camp type of programs,
Right.
or DCF programs, because families just wouldn't be able to handle those kids. So yeah, would be these out of care placements rather than in the community where they can develop skills and have the best support possible.
So I want, our viewers are probably listening and they might know someone, or they may have a situation themselves where they listen to you and they're like, oh, they could really help us. But you do have to meet that criteria.
Yes.
And you have to really kind of work the traditional therapy path and behavioral health treatment before this becomes something that you really need.
Absolutely. It's important that we use what we call the least restrictive environment. The thing that works best, the lowest level of care that works best. So if that's individual therapy and the child can just participate in therapy a couple times a month or even once a week, and that works, even if it's therapy plus medication and that works for the child, that's great. But if the ladder, so to speak, has been climbed and those things are not working, and you have helping professionals, so that's a big key too, that helping professionals are saying, we need something more intense. We need something more intense. This is not working as well as we'd like. Then those are certainly cases we can consider.
Well, Cindy, thank you so much for talking with me today and educating us about the CAT team. We're just about out of time, but I think you guys are doing some great work over there, so keep it up.
Thank you so much.
Yeah. The Community Action Treatment CAT team is a self-contained, multidisciplinary clinical team that provides comprehensive, intense, community-based treatment to families with youth or young adults who are at risk of out-of-home placement due to the mental health or co-occurring substance abuse disorder and related complex issues. The CAT team will provide family-centered, culturally competent services individualized according to the strengths and needs of each youth or young adult and his or her family, with a goal of supporting and sustaining that youth or young adult in his or her family system, or the least restrictive and most clinically appropriate environment. Family commitment and participation are essential and expected for the success of the services. For more information, check them out on the web at www.peacerivercenter.org or give them a call at 863-519-0575, extension 6735.